Hi, so right now we are currently in our radiology suite here at Pleasant Plains Animal Hospital, and I'm going to go over our radiation safety measures. So one of safety measures that we use here at the hospital are dosimetry badges. These are monitoring devices that are used to help track and evaluate OLARA procedures and to help ensure that individuals are not being overexposed to radiation. So OLARA stands for as low as reasonably achievable. So these monitoring devices have been developed to differentiate between different types of ionizing radiation. The film badge is the most common style of the monitoring device. So what this badge has is a small film wrapped in a light-proof envelope. So when we're not wearing these badges, you want to make sure that you're not keeping them in too high of heat, not keeping them in the sun, keeping them in a cool room temperature environment. Otherwise, it will affect the results that you get and what we track with this. So this badge should be worn on your thyroid collar, and it should be worn at any time that you're going to be exposed to radiation. So if you're in the room taking x-rays with someone, you should always be wearing this, and it needs to be on your thyroid collar. So the companies that make these badges are able to keep records of the results for individuals so that they are able to get to retrieve the readings at any time to see what their radiation exposure is. The annual maximum permissible dose is 500 millirems. So these different companies that make these dosimetry badges, they are able to give reports. And they do it quarterly. So here's one of the reports we have for Pleasant Plains Animal Hospital, and the wearer period is from September 2018 till December 2018. So you can see we have everyone listed here. So if you can see for mine, I have my name here, and then it shows the current dosage for me, and then the year-to-date dosage. So the year-to-date dosage for deep is 87. For the eye, it's 84. And for shallow, it's 79. And then for my lifetime dosage, deep is 103, eye is 100, and shallow is 94. So as you can see here at Pleasant Plains Animal Hospital, we are a low exposure practice. We try not to have the same person taking x-rays multiple times. We always try to have different staff members taking it if we know we're going to be taking a lot. So next I'm going to show you our PPE and how to wear that. So what we have our lead gowns that you would place on. We have our thyroid collars that you would put on next. The dosimetry badge that you want to place on your thyroid collar. And we also have our lead gloves as well. Another form of PPE you can wear is eye protection. We don't currently use eye protection here at this facility. And then for the lead gowns and the thyroid collars, you want to make sure that you're checking it every 12 months for any cracks and anything like that, because if there are cracks, then you're not being fully protected. And for the gloves, you want to check those every 6 months, just because when you're wearing the gloves, they can get bit by the animals. And if there's holes in it, then you're not being protected from that. So you always want to check before you take your x-rays that your PPE is good. And then when wearing your PPE, that only protects you from scatter radiation. So you should, even if you're wearing PPE, you should never have any form of you in the primary beam itself. When taking x-rays, if you have to do manual restraint and you have to be in the room, you should try to stand as far away from the beam as possible. And when you're taking the x-rays, never look directly at the beam, always try to look away. Okay, so now I'm going to talk to you about different types of restraint methods you can use for radiology. So one method of restraint is manual restraint, meaning that you are physically in the room with the patient and you're holding them in a certain position. There's non-manual restraint, meaning that you're using different positioning aids where you don't have to be necessarily holding them. And then another form of restraint is chemical restraint, also known as sedation. And ideally that would be the type of restraint to use every time you can take an x-ray. That's not always possible, but that would ideally be the first choice. And then when taking your x-rays, you can also use positioning aids. So we have those here. One form of a positioning aid would be the V-trough. So you can put them in here when you're doing BD x-rays. It helps keep them straight and they're not moving around too much. Another positioning aid you can use to help would be bean bags. You can hold their them in place. You can place them on their forelimbs, their hind limbs, whatever is going to help you get the shot. And then another form of a positioning aid could be tape. If you need to just get their leg or even their radius and ulna shot, you can tape down their paw. So that is another form of a positioning aid. So time and distance can also be used as safety measures. Times is the mean of preventing retakes. By doing it correctly the first time with the proper settings and the proper positioning, you ideally only want to ever take an x-ray only once for each time. That it decreases exposure for you and the patient. And then for distance, that is accomplished by staying as far away from the primary beam and the patient as possible. The intensity of the x-ray beam decreases to 1/4 if the distance between the beam and the staff member is doubled. So that's another way that we can use those as safety measures. Lastly, you want to make sure all non-essential people are in the room. So anyone under 18 is not allowed to take x-rays, and anyone who is pregnant ideally should also not be taking x-rays. So the first trimester is when the fetus is most sensitive to radiation. So for anyone who's pregnant, the maximum permissible dose is 500 millirem, and they get two dosimetry badges. One is their regular badge that they would still wear on their thyroid collar, and they have a second, a fetal badge that they would wear around their abdomen, and we get reported on a monthly basis. Okay, so long-term effects of radiation on the body can be somatic in nature, and that it only occurs within the body during the lifetime of that individual. Genetic damage can also be done, and that would be occurring for future generations of that individual that has had exposure to radiation impacts on their reproductive cells, such as the eggs and the sperm. Many tissues can be affected from radiation exposure. Those tissues include skin, the breast tissue, thyroid, bone growth centers, especially the bone growth centers. That's why no one under the age of 18 is allowed to take x-rays, because the radiation can have long-term impacts on their body. Okay, so today we're going to be doing a craniocaudal radius ulna x-ray. So first we're going to come to our software and we're going to select our image. So we're going to do the front right extremities, and we are going to choose radius ulna right DP. She's less than 20 pounds, so we have our settings. So 66 for the KVP and 3.2 for the MAS. And then we can come here to our technique chart just to double check. So we have 66 and 3.2. So I'm gonna go ahead and set that. And we are gonna have her in ventral recompency. We're gonna hold her forelimbs cranially, and we're gonna try to position her head lateral so it's not in the shot. And then when setting the border, we're gonna use her right arm. We're gonna use tape as our positioning aid today to help us get the shot. So we're gonna just put her down. We can always move the beam to fit her arm. We're gonna place it flat like this. Just tape it down. So we're just gonna move her up. We want to have the center with the midshaft of the radius and the ulna. We want the border to be distal to the carpals. So we're just going to move her down a little more into the shot. I know. So now that we have her set, we are going to have our marker in as well. And then we are going to shoot this x-ray.
Hello? We have a patient.
Yes, right now. 200 is way too low for that brush. I probably would have done like 3 or 4. Oh, what happened with that one? It's my G. Yeah, that's definitely not. That's like not. What happened to Stevie with that? Stevie's number is going in a circle below and it's definitely not. I wanted a what?
We're just going to crop our image. And we're going to add the marker in. And now that that's set, that's how you do a radius ulna x-ray. Okay, so today we are going to be taking a ventral dorsal thoracic x-ray. So we're going to select the view now. We're going to select thorax. We're going to do the thorax VD. And our patient is between 40 and 100 pounds. So these are the settings for the KVP and the MAS. So it's 90 and 40. We also have another technique chart here that we can just double check. So 40 and 100 pounds. For the thorax, it's 90 and 4. So we're going to go ahead and set that now before we get her into position. So we're going to go to 90 and 4. So now that that's set, we can get her into position. We're going to use our VD chalk to help position her for this x-ray. And then I'm going to be extending her forelimbs cranially, and Veronica's going to be extending her hind limbs caudally. And for our culmination, for our cranial border, we want it at our thoracic inlet. And for our caudal border, we want it at the first lumbar vertebrae. So we're just going to move her down a bit so we can get her chest in the view. We want to make sure that she is centered with the beam as well. And then this is her right side, so we're going to use the right lead marker for that. Now that we have her in position, we're going to put our gloves on and we are going to take the x-ray. Hi, you're okay. We're going to use another little chalk just to position her head, because it can be uncomfortable being in this position. So we have both of our gloves on. We can now go ahead and take the x-ray.
Yep. And if you want to bring back that beagle for me, and bring this back. One is an appointment, one's a DNA. Let me see which one is the DNA. DNA is death.
Yes, we have our view here. This x-ray, doing this position is really good for getting a view of the heart and the lungs. Our marker isn't in it all the way, so I'm gonna crop this and then just add the right marker in. And that's how you do a VD thorax x-ray. Go. Hi, so today we are going to be doing x-rays. We're going to be doing an extended VD of the pelvis. So we have Hydra here. She is sedated for it. That's the best method to do this x-ray. So we are going to get her into position. We're just going to put her into the V-chalk. we're going to put her thorax into the V-trap. It's the best way to position them for these x-rays. And when doing the collimation, you want to make sure for the cranial border that it's lined up at the crest of the ilium, and for the caudal border that we are distal to her patellas. So we're just going to set that up. This is her right side, so we're going to put the right leg marker there. So we have her in position. We just want to make sure the settings on our machine are correct. So we have it here. She is between 40 and 100 pounds, so the KBP is going to be 85. The mass is going to be 0.4. We also have a technique chart here, so we can check that as well. So we have 85 and 4. So we have our border set. We are going to put our lead gloves on now. Veronica is going to extend her form limbs cranially. I'm going to extend her hind limbs caudally and really extend them for this position, making sure we get her patellas in the shot. So now that we've had her set, we're going to take our x-ray.
That's okay, Mr. Oh, no, we're not gonna. She was just holding your hand.
Okay, we're gonna get Serenia. Serenia and subcute fluid.
Alright, so we're just going to rotate our image. And we're going to crop it. And that is how you do an extended VD pelvis. Hi, so here at our hospital, we use digital imaging to take our radiographs. So we use a software called IDEX PACS. And this is just, this is the software. So if you needed to look for a specific patient, you would just search in the search bar, and we're going to search for Oswald. And then we're going to search. And then we're going to double click and we can go to his x-rays. And this will show you how to view the recent x-rays he's had. So here you can see one of his x-rays. And then you can see that we also did a VD abdomen. And then these are all x-rays that he's had previously here at our hospital. And that's how you use the software. Okay, so today we're going to be doing an iohexidol contrast series on Julio. Iohexidol is a non-ionic, water-soluble radiographic contrast medium. Julio was here today for acute vomiting. We took a lateral abdomen and the VD abdomen, and the x-rays looked abnormal. There was a large amount of food in his stomach. The owner said that he hasn't been eating much, so the doctor would like to do the contrast series of his upper GI tract, just to make sure that there are no obstructions. So we are going to give him the iohexidol orally. We're going to do that now. We're going to make sure we give it slowly so he doesn't aspirate. We're just going to do a little bit at a time. Okay. So now that he's taken the iohexidol orally, we are going to do an x-ray at 0 minutes, we're going to do an x-ray at 15 minutes, and then again at 30 minutes. Okay, so we have Julio here. We just finished giving him his iohexidol, so we're going to go ahead and do a lateral abdomen to get our 0 minute x-ray to start the series. So I have the marker here. Just gonna position him. Down. Right. So we have our x-ray here. You can see that it is radiopaque. So we are gonna take it again in 15 minutes just to see if it's going to move at all. We're now at the 15-minute mark for our series, so I'm gonna take another lateral abdomen of Julio. We have our second x-ray. We are at our 15 minutes of our contrast series. So you can see here, just looking at our PAC system, that we do have our second x-ray here. We're just gonna crop it and add the marker in. And then we are gonna have the doctor look at them and compare them and see if we've moved and how much we've moved from the 0 minute x-ray to the 15-minute x-ray. Okay, so we've taken the x-rays for our contrast series. We did the 0 minute mark, 15, 30, 45, and 60. So we have 4 of them up here just to compare side by side. You can see throughout the x-rays that the iohexidol has moved throughout each one. The doctor is still kind of iffy on these x-rays. She would like to send them out for a consultation, as there is still a possibility that we will be doing an exploratory surgery on this dog tomorrow.
Okay, I'm Dr. Melaleo, Medical Director here at Pleasant Plains Animal Hospital, and I have the lovely opportunity to help Christina through her radiology course this semester. She's come a long way. The good thing about working with Christina is that she had a lot of knowledge to begin with. She had taken x-rays in the past and knew plenty about positioning. I think during this semester she really nailed down the lingo that goes along with the radiology. So names of bones and joints and proper names, bones, joints, positioning. We worked on her technique and positioning just a little bit, but overall her skill set at this point is a 10 out of 10. I have no concerns about Christina taking radiographs here at our practice.